I use Open Notes all the time. I have multiple specialists that take care of me, so it's really helpful to kind of make sure that they're doing what they're supposed to be doing. The notes seem to humanize us to them, at least the ones I've read. I mean, they make pointed communication about us. You get exactly what was happening, and then you also get his little synopsis of, you know, how I was that day as a person, not just as a patient.
I went in, it's the only time I've read my notes since, and I was so impressed and pleased by how she established the relationship with me, and it made me feel so good that she really cared for me, and I had such confidence in her because she remembered every detail. So it just made me feel great as a patient.
I don't want to be one of those seniors that's going to the doctor every day. And I don't know when the emails started coming out. That's when I really learned that the past visit, you know, and then clicked on it and thought, wow, this is kind of cool. Until I got to Kaiser and started reading the past visits and that sort of thing, did I understand what was going on.
So it's really nice to hear that, to be able to read that verbatim of what they were telling me, not just the little after-visit summary. So I'm very appreciative of that.
And being able to go back and get the doctor's interpretation of a PET scan at one point, and then to see him explain it in another PET scan report, and yeah, I just think it's fabulous. It helped me follow through on the things that I had to do and gave me a little bit better understanding how I was going to get through this.
If you have multiple health problem, then you like to hear one thing, but then maybe the provider tell you a couple more things, and then you might not pay attention to it. So that's why I think this is very useful and very valuable.
I probably go on way too much, but it does give me information that I can read.
Yeah, that's great.
And that's really helpful.
Yeah.
And it probably saves calling the doctor and bugging them because they're busy.
It's not only a check on what the doctor sees, it's a check on how we're doing as well in terms of getting information out there. Is there really understanding? Has true communication occurred?
I'm delighted to see it, and I will always look for it now.
Why are you delighted to see it?
Because of the old phrase, know thyself. You know, the more I know about myself, the better person I can be in every way.
I think people have a lot of fear about it, and the doctors are going to be very upset, and you know, it's going to create a lot of trouble for the care delivery system, and that has not been the experience of any organization, and I think we mirrored that. It was business as usual, and people just continued to do their work.
We're worried about too many questions about what we write, you know, patients being upset about what they were going to read. I definitely had those concerns at the beginning. Once I thought more about it, they have their medical record as theirs. It's been shocking how I'm really truly amazed how little problems we've had because of this.
I guess the one concern I thought, what if it's a hassle? What if I have 10 people a day saying, oh, you made a mistake? But it really was never like that.
I didn't feel like there was a lot of resistance in my department, and that's mostly who I talked to. And I haven't heard a lot of people coming to me and saying, oh boy, this is really a problem. So I feel like it's been a relative non-event, both in the lead-up and also after the implementation.
Well, it brings healthcare more into the 21st century. I mean, it gives access to their healthcare. I mean, we've always given them access. We're just making it easier.
You know, we just presented them with the data, the evidence, that it was a good thing, and that where it had been done, despite all of the fear and trepidation, it had largely been a non-event, and that patients pretty much appreciated it, and that their perception of their clinician actually improved, and their perception of the health plan for being willing to go there also improved. I think there are times when we just have to put our personal feelings aside and do what's right for the patient and what's right for the organization.